So my name is Drury. I am the mom of a medically fragile child who together we navigated the healthcare system for close to a decade, and she suffered from a rare, originally undiagnosed disease, and then a disease that was diagnosed, but it was still an ultra rare form of mitochondrial disease. So I'm very active in patient partnership, in patient engagement and leadership, and I bring that passion because of my lived experience with my daughter. My position now is as the chair of the Minister's Patient and Family Advisory Council for Ontario. So I'm an advisor to the Ministry of Health and Long-Term Care as well as to the Minister, and I chair a council of over 15 Ontarians as well as about 1,000 patient partners across the province to offer the perspective of lived experience of patients, families and caregivers, and to share that knowledge and wisdom back with the healthcare system. I have some personal lived experience with my daughter. I think it's really interesting how that came about, and it was a relationship between one of our clinicians, our metabolics physician, and a researcher who was doing some basic research into mitochondrial functioning. And my daughter had a mitochondrial disease that was recessive genetic in nature. And so that relationship came about, sort of serendipitously. I walked over to his office and said, I understand you're doing this research. Our clinician had made us aware, and I'd like to know if there's something that I can do to share information about my daughter or share information about her particular mitochondrial disease and dysfunction. And I think it was really interesting because at the very beginning, I'm sure this researcher was, what is this mom going to have to offer? And we actually go out and speak now about the relationship and the trust that we build. Building trust came through conversations, and it came through mutual respect, and that mutual respect built about me sharing my experiences and this researcher being open about his experiences, him being open about what he was interested in investigating, but also me being able to share with him what I felt was important to investigate and what would change our life. So supporting engagement and partnership in research starts at a level of, first of all, identifying who those patient and family and caregivers are that want to partner. And so I think we've got to be really public about the opportunity. I think we've got a really great baseline to start with the introduction of SPORE, the Strategy for Patient-Oriented Research from CIHR. But I think we want to open up that opportunity to more people. I'm not sure everyone's aware of that. The second thing is that not everyone is sure what they can contribute to research. So training, and I'll use that word loosely, but training patient partners and training researchers at the same time in the same room as to what it means to partner in research. What is it that we're here to do together? What does that look like? So that education, that training, and then ongoing support. Peer support, so patient advisors who've been involved in research for quite some time, coaching other patient advisors or supporting them, but also peer support amongst researchers. So I love that you're grounding this in lived experience. I mean, that is the fundamental value of patient engagement, patient partnership, patient leadership. It's all about the fact that we're looking at things from a different perspective and from a different lens, which is the lived experience. And so sharing that as a resource to other either practitioners or researchers or patient partners who might want to be involved in research, it's highly valuable. I'm not sure if it's been done anywhere else. The other thing that's wonderful about what you're doing is that it's an online resource. And so, at your own time, at your own pace, a resource that's available to you on your smartphone or your laptop, wherever it might be. I think sometimes we rely a little bit on, training that's done in person or, bringing people into conferences. And again, we've got to think through the time and the availability of patient partners and also supporting diversity and equity.